Well, we're all very much aware of COVID-19, the pandemic, and thankfully, hopefully, light at the end of the tunnel with vaccines. But there are so many questions we have regarding COVID-19 and the vaccine. So I'm joined today by Dr. John Passini from Duke University, an electrophysiologist, and also a medical advisor to Arrhythmia Alliance. Thank you for joining us, John. And also from Cristiana Montero from the John Radcliffe Hospital in Oxford, UK, who's a highly specialised physiologist. Thank you both. And I'm going to bombard you with a lot of questions. We have been inundated and continue to be so. The vaccine's been around for just a short while, and yet millions of people have now been vaccinated, but there's a long way to go. So let me start asking just some of the questions. We have an online forum, which obviously is international. And so some of these questions I'm going to have to direct at each of you, because sometimes on our online forum, a debate arises because it varies from country to country. So John, starting with you, to date, who should now have had access to receive their vaccine?
Oh, Trudy, it's a great question. And first of all, let me say it's great to be here. I would say even within the United States, there's going to be some variation on who's getting vaccinated. So in our own area here in North Carolina, frontline healthcare workers should have already received vaccination. We have now moved on to essential frontline workers. And those individuals over the age of 65, prioritizing those over the age of 75. And our health system has delivered over 100,000 vaccines at this point. But again, I do want to emphasize that that will vary across different regions of the United States. But like most healthcare providers, I would just urge anyone, if you are given the opportunity to get the vaccine, please, please, please avail yourself of that opportunity.
And Christiana, in the UK, where are we?
So by now, the higher risk category of the elderly living in nursing homes, they should have all been vaccinated. So at least with the first dose, as you know, in the UK, we've changed our guidance. So an interval of 8 to 12 weeks between both doses, as well as frontline workers, frontline NHS workers, social care workers, and we are now moving on to the stage of anyone over the age of 70.
Just recently in my own area, they are now covering people from 16 to 64 with underlying health conditions. So I had my vaccine yesterday.
Well done.
Even in the UK, it varies, but certainly everyone in the UK over 70, but they're gradually working down. So if I have an arrhythmia, does this automatically make me a priority to receive the vaccine? And we've been inundated with that question, whether I have an arrhythmia, whether I have atrial fibrillation, does that make me in the vulnerable category? Christiana.
So no, not necessarily. It depends on whether you are under the official high risk category and you've been told to shield. So whether you are a heart failure patient, so life-threatening cardiac conditions, having something like atrial fibrillation does not put you at a higher risk of COVID-19 complications. So they wouldn't have prioritized you for the vaccine. However, if you do have other risk factors, such as your age, obesity, for example, other conditions, chronic kidney disease, then yes, you would have been prioritized, but not necessarily because of an arrhythmia. My advice, as always, is every patient has a unique story. So if you have these questions, direct them to your doctor because they will know better than anyone what's the best guidance for you to follow.
Thank you. And John?
You know, I think Christiana has done a beautiful job summarizing it. And I think one of the points she made that's worth, emphasizing, AFib often is not in isolation. In fact, in most cases, it's not in isolation. So just like we counsel patients to think about their risk factors because we want to control them and make sure they're not contributing to more atrial fibrillation. Many of those risk factors are considered high-risk conditions for the coronavirus. And again, the best way to sort this out is through a discussion with your healthcare provider.
And John, do all the vaccines offer the same level of protection? You know, we take a flu vaccine, nobody asks which flu vaccine we're getting or what the efficacy is, this new word that's entered the general vocabulary of efficacy that lots of people have not heard before. And now everyone, which vaccine did you get and what is the efficacy? So do they all offer the same level?
So I want to make a few points. I'm not a virologist and I'm not a vaccine specialist. And I think you don't need to even be a healthcare professional to realize that there are some differences in the efficacy of the vaccine. I think I would echo the message that public health authorities are trying to deliver, which is all of the vaccines that have been approved for emergency use offer a great deal of protection. And even if one gets vaccinated and then does acquire the coronavirus, that is not a failure of the vaccine per se, because the purpose of vaccination is not just to avoid infection, but in the unlikely event that one does get infected, that one will not have a severe course, will not have to be admitted to the hospital or suffer any severe consequences of the illness. So, you know, again, that leads all health authorities and certainly us at Duke to recommend that, you know, when you have an opportunity to get the vaccine, take it regardless of what vaccine it is.
And John, I mentioned the word efficacy. Could you just briefly explain what does that mean?
Sure. So when we talk about medical therapies, we always talk about efficacy and safety. And efficacy is the concept that the treatment does what it's supposed to do. So for example, if we prescribe a medication to prevent episodes of atrial fibrillation, its efficacy is how well it does that, how well it reduces the amount of AFib. The other component of that, of course, is safety. When we take treatments, we know that there are some risks, but we want those risks to be small and manageable. And you asked me about efficacy, but I will seize the moment to sneak in some information about safety. I mean, these vaccines have been studied in thousands and thousands and thousands of individuals. And it's important to note that some of these vaccines have been studied in way more patients than a lot of well-accepted treatments that we've had for decades. So they do appear to be very, very safe. Adverse events can occur, but they're very rare.
And Christiana, are there side effects with the vaccines?
Side effects, I can speak from personal experience, a very sore arm, but that was the worst I had. Oh my God, it was sore. But that was the worst I had. There are other side effects you could have. The one thing we need to understand about side effects is most of them, they're just a reflection of your immune system acting against this new body. So they're actually a good sign. I actually don't mind having side effects as long as they're not too severe, because it shows that my body's doing something. But yes, so you may also develop a fever, a cough, so symptoms similar to the coronavirus symptoms, because your body thinks it's fighting coronavirus when it actually isn't. If you do experience these symptoms, the longest they'll last is about 2 days. Although in my case, I only had my sore arm for a day.
Yeah, some people have said about being extremely fatigued and getting a headache, but it's normally gone within 24 to 48 hours.
Absolutely.
The message is that you may not get any symptoms and it's still working. And if you do get symptoms, it's telling you it is working as well. So yeah, that's great. Thank you. Obviously, I'm sure, John, you won't be surprised at the next question, but can the vaccine trigger my AF, my AFib?
It sure can, but I would like to back up and I think one of the big words that we always need to talk about with coronavirus is fear. And fear of any illness is understandable, but we can't allow fear of illness to paralyze us. And even in patients, University of Pennsylvania did a very nice study where even patients admitted with severe COVID, 700, only 25 had new onset evidence of AFib. So, it can occur. Atrial fibrillation can be exacerbated by COVID, but even, among a large cohort, it's relatively infrequent. Can a vaccine trigger an episode of atrial fibrillation? Well, of course, any, physiologic trigger or stressor can induce an episode of atrial fibrillation. We cross the street to get to a grocery store on the other side because we need food and we need, the essentials for daily living. And crossing the street and getting scared by a car could induce an episode of atrial fibrillation also, but we do it. And yes, so theoretically, the fevers and things that accompany the dose of the vaccine could trigger an episode of AFib, but the likelihood of that is extremely small. And the benefits, it would be hard for me to put into words how dramatically more the benefits outweigh the risks.
And so if my condition changes once I've had the vaccine, whether it's AFib or palpitations, etc., what should I do?
Yes, if that happens, you would follow the advice your healthcare providers have given you for really any episode of atrial fibrillation. If it is self-limited and doesn't cause one any symptoms, shortness of breath, lightheadedness, any of those things, there's probably nothing one needs to do about it. If it's sustained or if one feels unwell, then of course contacting your healthcare provider is essential.
Thank you. I think this is the most common question, and I don't think you'll be surprised, but I'm prescribed anticoagulants, or blood thinners as some people call them. Should I still have the vaccine? Will it interact with the anticoagulant? Christiana, do you want to take this one?
Yeah, absolutely. Yes, do you have the vaccine? That is actually one of the questions they'll ask you on the consent form is, are you taking blood thinners? And that is not going to stop you from having the vaccine. It's just so the vaccinator, so the nurse or healthcare practitioner who's going to give you the vaccine knows they are to expect a little bit more bleeding when they give you the injection. But that's all that could happen. Yes, if you are taking blood thinners, do still have the vaccine. The benefits largely outweigh the risks. In between different blood thinners, if you are taking warfarin, it's important that your clotting levels, your INR number, is within the normal range. And that's something I think they will also ask you when you consent for the vaccine. But yes, absolutely have it.
Thank you. And John, what about any other antiarrhythmic drugs and the vaccine?
Yes, we can categorically state that one's cardiovascular medicines should in no way influence whether they do or do not get the vaccine. Like take an anticoagulant. We draw blood in patients on anticoagulants. Surely the small needle associated with a vaccine is lower risk. So no contraindications with respect to medications.
The needle is so tiny with the vaccine, isn't it? It really is just a pinprick, yeah. Another question, some people are still having their flu jabs. Can they have their flu jab at the same time as their COVID vaccine? John?
I am not aware of any contraindications, although I'll say, at least in the United States, influenza vaccination is predominantly an activity of the fall and early winter. So presumably most individuals who are going to get the flu vaccination have already gotten it. Of course, I would prioritize coronavirus vaccination over flu vaccine if someone had to make a choice, but you don't, of course.
And I know, the next question, it's really difficult because it's changing almost daily, but Christiana, do we have any data to show how effective the first dose is?
So there's actually some real world registries and some small studies. starting to come out from different areas in different countries. And actually, although we're still seeing coronavirus infections happening, the severity of the symptoms is largely reduced by the vaccine. So some people who would have probably experienced more severe symptoms are experiencing mild symptoms or asymptomatic symptoms. And I think this is something that it's really important to highlight. If you have the vaccine, may it be the full 2 doses or just the first dose for now, you still need to follow government advice. So wash your hands, wear a mask, because you may still be able to spread the virus even if you're not experiencing the symptoms. And I think that's one of the messages that probably hasn't been efficiently given to people, is that we are trying to reduce the burden on hospitals, on hospital workers, not because we want them to have a good time off, but if hospital workers cannot provide good levels of healthcare and you are unlucky enough to become one of their patients, it's you, the patient, who's going to suffer. So we want to reduce the burden in hospitals, and that's why it is so important you have the vaccine. You will not be as unwell as you would if you didn't have it. You may very well not get the virus at all. I know of cases of people who've been to countries, South Africa, for example, where one of the parties who didn't have a vaccine got the virus, and the other one who had the vaccine didn't get the virus. I know that that's just a simple case, but I think it's very explanatory of the effect the vaccine can have. But the main thing is we are trying to reduce the burden in hospitals and to healthcare workers. So if they do need to look after you, they can do it safely and well.
Absolutely. Now, we hear a lot about many of the ethnic minorities and low-income communities hesitant to go forward to have the vaccine, whether that's on religious grounds or whatever. John, what would your advice be to those communities?
Yeah, to those individuals that have concerns about the virus, whether it's any type of concern, distrust over the healthcare system, distrust over the vaccine itself, distrust of the individual data, my advice to all of those individuals is the same. Start a conversation. Be very direct with your doctors and clinicians. Tell them explicitly why you are concerned. And then ask them if they've been vaccinated. Because, you know, if your doctor has been vaccinated, presumably they know quite a bit about medicine and they made that choice. And so you should, if someone has fear over getting it or concerns, I think discussing it with their own doctor and raising those questions aggressively is important.
Thank you. I think that's an excellent answer. Then we moved on to pregnancy and the vaccine. Should I take the vaccine if I'm planning on becoming pregnant shortly? Christiana?
Yep. Yes, absolutely. Absolutely. So although the trials didn't include pregnant women, and that's for ethical reasons, there's a lot of bureaucracy in research, and basically we cannot decide, we cannot make decisions on behalf of the baby we're carrying, so we cannot enroll on a clinical trial if we're pregnant. But women who are pregnant or considering getting pregnant who are healthcare workers, they've all been advised to have the vaccines because they're at higher risk due to their exposure. And many have been, and the real life data from this initial vaccination stage from all over the world shows no negative effects at all.
So whether they're wanting to become pregnant or if they are pregnant?
Yeah, after vaccine.
And John, what about women that are nursing, breastfeeding? Should they go ahead and have the vaccine?
You know, again, I always have to mention that I'm an electrophysiologist and not an infectious disease specialist or virologist. But I would answer that, Trudy, by saying that again, I look towards the people who are experts, and I have been overwhelmed by the number of pregnant women and women with young children who have gone on social media, who are healthcare providers, and said, based on my ascertainment of the risks and benefits, I'm making this choice to protect my family and my children and myself. And I think that the general consensus is yes. But obviously there is no hard data or clinical trial that one can point to. But I think women in leadership positions in women's health have clearly made a unified effort to speak with one voice on this. And I think it's pretty clear, yes.
Thank you. John, any message, any final message to the people watching this today regarding their arrhythmia, COVID, etc.?
Ask questions, take care of one another. It's a very difficult time for all of us, but by keeping a dialogue open, asking questions, and taking care of one another, we're all going to get through this. And I really want to emphasize something Christiana said. Everyone should feel safe in the healthcare environment. We've looked here in North Carolina, the risk of contracting the coronavirus in a healthcare facility here is dramatically lower than the community. So the truth of the matter is that going to your physician or going to the hospital is lower risk than going to the grocery store. It sounds fantastical, but it really is true. And I hope everyone stays well and stays healthy.
Thank you. Christiana, can you add to that?
Well, I need to echo John's words, because actually since last March, I haven't been to a supermarket. I've been getting everything delivered, but I've gone to hospital in the meantime and I haven't got COVID. So I think that serves to show that, yes, hospital environments are very, very safe. I think I need to make the same disclaimer as John did earlier. I'm not a virologist. Although I work for Oxford University, I'm not a part of the amazing team who's worked on the Oxford vaccine, but I can do ensure that safety is key when studying and making vaccines. And I can tell you from my own experience, during the first lockdown, so back in March last year in the UK, I work in a research facility for Oxford University, a cardiac research facility. And all of our funding, it wasn't withdrawn, but it was stopped. So we could redirect everything, every single resource to studying the vaccine. Was it too quick? It may look like it was too quick, but we managed to overcome the sometimes ridiculous bureaucracies we have to go through, all the logistics, everything was optimized. People united in fighting the virus, and everyone wanted to join the trial. And that's why we managed to get so many participants. More than 11,000 people joined the trial in the UK alone. And if that's happened in Oxford with the AstraZeneca vaccine, it will have happened with the other vaccines, Pfizer, Moderna, all the other vaccines that are available. And again, as John mentioned before, once the studies are published and the trials end, the vaccines have to go through a regulator, a government body, who then again reassess the safety of the vaccine before it is given to the general public. So you are very, very safe and do have the vaccine. Social media can be a horrendous black hole, and many of us are only getting our news from social media. And I'm not going to delve into philosophical thinking about social media, but do prefer your doctor over social media. As John said, speak to your healthcare provider, ask them any questions you want to ask. They will be prepared to answer them. These are highly trained professionals who do this for a living, and they will be the best people to answer your questions on regards to your heart health, on regards to COVID-19, not social media.
Thank you both so much. That is fantastic. And it was really quite emotional at the end to feel the passion that you both have. And I know we have at Kidney Alliance. And you know, if any other illness, we ask our doctors, and COVID-19 is no different. Ask your healthcare provider. If you want to then discuss it again, call us. We're here. We're engaging with the doctors to make sure we fully understand, and we only ever give out accurate and information that has been approved by our medical advisors, such as Dr. Bassini and Christiana. So thank you both so very much for giving your time. I know that all healthcare workers throughout the world are really under pressure at the moment. So for you to take this time out, but I can assure you this is going to reach tens of thousands of anxious, worried people. So it's going to make a huge difference. So please, both of you, stay safe, remain well, and we all must remember to wash our hands, wear a mask, and keep our distance. Thank you so much from Arrhythmia Alliance.